Today we're going to fill some lips, and we're going to use this new DermaSculpt needle. I've published several articles on using micro-fat injection cannulas to fill the lips, and I think this is a great concept, and I was real happy to see this company come out with this needle, and it is a blunt cannula. It's not sharp, and it has obviously a small hole in the end, and it's very flexible. So we're going to use this. Because it's not sharp, what I like to do, first of all, this patient's already been anesthetized with infiltrations. And so what I like to do is to make a puncture hole with a 25 gauge needle. You can use a bigger needle, make a bigger hole, which is a little easier to find, but then again you have to worry about expressing filler out of that hole. So what I'll do is I'll thread this, and in this particular case with this lip width we will probably do 1/2 on each side. So what I'm doing is simply injecting as I withdraw, and I'm going to have more filler in the front of the lip, in the anterior, and then as I move laterally I'm going to taper my fill. So you can see that half of the lip is treated. The really nice thing about this cannula is that it is very atraumatic. It just won't lacerate tissue, and typically these patients bruise a lot less than other patients with traditional needle techniques. When I do this with a fat injection cannula, I will typically use an 18 gauge needle for my puncture. So you can see that this conveniently goes to the center of the lip. And again, we're going to taper our fill as we withdraw. And it's important to achieve a symmetry. Now, one thing that I think is important with all filler is to massage. We're going to put a little Vaseline here, and when you have these punctures, you don't want to massage the filler out the puncture, so you want to massage away from the filler initially, and then the assistant can put the lip on stretch, and that also helps you massage and as well as obturate there. So that's a nice little fill. Now we'll move to the lower. Open, please. And I keep this on the lower more in the central 2/3 of the lip. Obviously, every patient is different. So on the lower lip, I'm probably be able to do this with one single injection. So I'm going to go from tapered to a larger fill in the center, and then back to a taper as I come out laterally. And again, this is very flexible and blunt. And I think the biggest advantages of this type of situation is the fact that there's just no sharp needle to lacerate the tissue, and these people just do so much better. It also makes the procedure a lot faster. Put your lips together there a second. Relax. And now you can also use this to do your outline, as the needle is small enough that you can get in the potential space between the skin and the orbicularis oris muscle. But what we've done right now basically is just done deep fill, or put air in the tires, and this patient could easily use more augmentation on the lower, but this is a single syringe fill right now.